In the next edition of It's About Money, my guest will be Valerie Way, and she is the Executive Director, President, CEO of Mental Health Association. Listen in to how the association keeps the community well. Hello and welcome to another edition of It's About Money. I'm Nannette Nocon and thank you for joining us. My guest today is Valerie Way, and she is the CEO and President of Mental Health Association. We're thrilled to have you here with us today, Valerie.
Thank you for having me.
And I will disclose that I apologize for my cap. I usually don't do this, but had some eye surgery and I thought it's better that we use this cap. So anyway, so thank you for being here. So tell us about the Mental Health Association. Very excited to learn about this for the first time.
Oh, good. Well, again, thank you for having me today. The Mental Health Association of Rochester is actually an affiliate of a national organization, Mental Health America. And it was founded back in 1909 by a gentleman by the name of Clifford Beers, who he himself experienced and witnessed abuse in mental institutions. And so when he left, he vowed that he wanted to make experiences for people with mental illness better. And so today we have MHAs, mental health associations all around the country. So Mental Health Association of Rochester was actually formed in 1932 locally by local citizens who they themselves wanted to improve the experiences for people living with mental illness. And so in 1992, the MHA became its own 501c3. And started as a advocacy group and has since grown with their programs and services. So for me, you know, it's been a very exciting time because I'm a clinical social worker who has been working in the Rochester community for over 25 years. And you know, knew of Mental Health Association for all those years and worked alongside them, had individuals I worked with, you know, attending Mental Health Association programs. And it's exciting to be part of the organization today.
That's great. So from growth, from being an advocacy role to having programs
Yes.
that benefit the people who use the mental health services.
Yes.
Yeah, that's beautiful. That's great. You know, I never thought of that, but I think that's really important. So what is the mission of MHA?
Yeah, so we use peer support, you know, to promote wellness, mental wellness through our various programs and services. We're not an organization that has doctors or therapists or nurses, but rather the folks that we have employed are people who themselves have had their own experiences with their journeys around mental illness, addiction, and other behavioral health conditions. And so they are there to mentor other people who are going through their own experiences.
So that's really important to have that experience to be able to relate to.
Absolutely.
Yeah. Okay.
Yeah, it's a different kind of support. You know, we're in addition to formal, you know, services such as clinics or, you know, medications or, you know, therapy and things like that. But you know, it's a place where people can come to find community support and to engage with people who have been there, who know it and can relate in a different way.
It's just making it whole for the person to have good mental well-being. Like
Absolutely.
Yeah, as you're describing, that's what comes to mind. So talk to us about some of the programs and services that MHA offers here in Rochester.
So we have so many programs and services. We recently reorganized, so we have 5 main departments, if you will. One of our primary departments is prevention and community outreach. So we, love it when people come and invite us to tabling events or community events so that we can do outreach and education and awareness in the community. We'll do workshops in the community to help people understand about mental illness and mental well-being. We provide support to people who are hospitalized on the inpatient psychiatric units because, again, that can be kind of a scary or lonely experience. And so, again, we have peers that will provide support to people and kind of offer them a different perspective and offer them support for when they are discharged from the hospital. We also have community navigation services. So, so many times people find it confusing to navigate all the different resources in the community. And so we have a community navigator that can help them do that, in addition to get connected to public benefits and things like that. Nice. We have what we call a drop-in center. So for people experiencing a crisis, in which isn't as critical as going to the emergency room, but maybe they're finding themselves in crisis, they need support, they need somebody to talk with. We have a drop-in program, so people can come Monday through Friday, 1 to 9 p.m., or Saturdays and Sundays from 11 to 7. And they can just drop in, and we have people there who will talk with them. For some individuals living in crisis or feeling like they're in crisis is continuous. And so we can also help them develop coping skills and ways to kind of manage that ongoing crisis.
That's wonderful. So it's kind of like social work in kind of full blown.
Yes.
That's great.
We have a lot of programs and services for adults, providing one-to-one peer support in the community. We provide services to youth. So again, for youth who are dealing with mental health challenges, we have, it's called Youth Peer Advocates, and they too have experienced what it's like maybe to be in public systems and or maybe experience mental health challenges, so they can mentor other youth and what it's like. We have we work with families, so families and caregivers are in a unique position too, right? As they're trying to navigate the system and be advocates for their child in the school system. So we have family members who are advocates and can help mentor individuals, families and caregivers with their child. And then lastly, we have what we call education and vocational services. And, so many times people, mental illness is impacted just kind of their trajectory of life, whether it's, kind of caught them off course with, developing what they want to do with their life and find purpose. Sometimes illness hits people midlife, and after having an experience, people say, gosh, I want to go a different direction in my life with work. And so we have staff there who can help guide them and, find a different path for purpose. And one of those opportunities is we have what's called a peer training academy. And we have an academy where we will help support individuals who want to become certified peer advocates. And we teach them how to do that and get them connected to the education and the resources for them to do that, and then help them find employment in that profession.
Yes, that's beautiful. So these peer advocates, they are working for MHA or they're volunteers?
They're working for MHA.
Oh, okay,
yes.
I see. Great. Oh, that's terrific. And so there's the coursework then requires that they enroll in the program? They have to pay the tuition and things like that.
Yeah, well, actually, that's free. They do provide a tuition to the state in terms of going through the academic online learning that is required.
Okay.
But we support them in that process.
I see. So they know how to navigate through it. Yes.
Correct.
Okay. Oh, great. Oh, that's wonderful because it's training. And actually, what's interesting about that, in my head, a person who might need the service might say to someone, "You don't know what I'm going through."
That's right.
But if it's a peer advocate, then
That's right.
they should have some perspective
Yeah.
of what they're going through, which makes it a nice,
Absolutely.
more comfortable way to be able to express. At least from an outsider, that's what I'm, feeling from what
Absolutely.
you're thinking. I'm thinking of
Absolutely.
what you're saying.
Nobody goes through the exact same experiences,
Sure.
but there's commonalities that you can share, and there's an understanding and an empathy.
Mm-hmm. That's great. Do you find that you have to recruit for people to go through the program, the training program, to be certified? Or
We do, although it has become more popular. The peer movement has become very popular. It's developed in the last several decades, and what's exciting is that our healthcare system has a place for peer advocates, and so there's more of a demand for them.
yes.
And so it's important that we train people and get them certified so that we can really help in the delivery of peer support in the larger healthcare system.
That's great. So from a financial perspective, there's recognition for the need.
There
That's why
is.
training is free, but it's just a matter of aligning people.
That's right.
And if someone suffers from mental health and got the help from a peer, they too might be inspired to want to do the same thing.
Absolutely, absolutely. And we hear those stories every day.
Oh, well, cool. That's great. I love it. I love it. We're going to take a short break,
Okay.
but this has been really fascinating. I want to learn more about it. So
Okay.
thank you. I've been talking with Valerie Way, and she is the president and CEO of Mental Health Association in Rochester. We'll be right back.
There's been another deadly shooting at a local elementary school. According to authorities, the suspect acquired the gun from a family member's home before using it to take the lives of innocent children and teachers.
Store your gun securely, locked, unloaded, and away from ammo.
And we're back. I'm Nannette Nocon. It's about money. My guest is Valerie Way. She's the CEO and president of Mental Health Association of Rochester, and we're so thrilled to have you here. Thank you for
Thank you.
sharing such valuable information. So talk to me about the demographic that could best utilize the service of MHA.
Yeah. Well, you know what? I will say it's everybody, anybody and everybody. I don't know anybody who hasn't been touched by mental health, mental wellness in some way. As I mentioned, we have programs and services to provide general awareness and support. We have a monthly speaker series that we do, and that really is open to the community, to who has an interest in learning more about mental well-being and about the resources in our community. We serve individuals that might have a transitional or episodic mental health condition, and then we also serve individuals who might have more chronic, ongoing mental illness. We serve individuals that are of all different demographic makeup, so in terms of age, in terms of gender identity, in terms of race and ethnicity. I would say we have programs for probably anybody and everybody.
Yeah, that's great. So talk to me about the economics of it. So walk me through the process. Let's say I'm a person who dropped in and needs service. Do you take my medical insurance? How does that? How does someone? What is the process of onboarding, I guess, for lack of a better word? Is that the right word?
Yes, yes. Well, again, it depends on the different programs and services and what the person is interested in. The best way to get connected is just calling our main number, 325-3145, and asking for our MHA ambassador. We've identified one person who can be a link to the community and can answer questions, can explain the referral process, what's needed. He's willing to give tours. And sometimes people just drop in and say, gosh, I was dropping by and I wanted to learn more about it because I've been thinking about maybe coming here. Is there somebody that can give me a tour? And he's available to do that as well. But most of our programs and services are at no cost to individuals. There are some programs where the program is targeted to individuals who have Medicaid, and so they may have to be a certain age or whatnot, but I would say for the majority of our programs, they're at no cost for the individual. We get funding through what we call net deficit funding through the state, which then comes through the county. And so, we have those kind of contracts. We also have contracts with the state education department through what's called Access VR, and that's for education and our training services. So, we really use a braided model for funding all the different programs and services. Certainly, we get funding through donations and fundraisers and things like that, because there's always programs and services that we want to support, but we don't have specific funding for.
I see. So depending on the program, there could be government money, but maybe
Correct.
not that particular innovative thing. And how connected is the local affiliate of MHA to the national organization?
Well, I was just at the national conference last week.
Oh, okay.
It's very exciting. We have a number of MHAs in New York State, and we have a state chapter. So we come together as affiliates within New York State. And then we come together at the national level. We just had our national conference last week in Washington, D.C.
That's great. Oh, I love it. I love it. Since you started with MHA, talk to us about the changes and growth that you've seen during that time.
So I've been with the Mental Health Association. I just celebrated my 1 year.
Yeah, congratulations.
Thank you. And so in that time, we've moved our site. So we had formerly 2 locations, and we've moved into one site now at the Village Gate.
Oh, okay.
And it's a larger space, a more modern space, so that we can do more, and it allows us to all be together under one roof. So that's really exciting. We've been expanding our services in Livingston and Ontario County, so beyond Monroe County. We've been really getting focused on the types of programs and services that we want to offer the community, and really taking a deep dive into what does our community need, and how where are the opportunities that we can help fill the gaps. And it's been really exciting because we're partnering and we're talking with community groups that we haven't before.
That's great. That's great. Could you repeat the number again? So it's area code 585?
Yes, 585-325-3145.
Okay, great. So we'll put it on the screen so that people would see. Thank you so much. So what about serving those people that the commute might not be as convenient? You're in Livingston County. Do you do virtual work as well? Yes.
Yeah, so we actually have staff that work in those counties, and so they'll provide services in those communities.
I got it.
And we partner with the community mental health centers there.
I see.
And so it's a partnership.
Oh, beautiful. That's great. It's nice that it's not in lieu of, but you work together.
Yes.
Because I see it more of like enhancing
That's right.
what's being there, because sometimes that's the missing part. Like you said, how do you transition back, or
Yes.
so all those things.
Yeah, and certainly in the rural communities, transportation is more of an issue.
Sure.
So, we have to think about that and provide funding and support for people in those communities especially.
That's great. So a lot of employers have, hotline for mental health and things like that. Is that a space that you guys get into or not really? It depends on.
It's not something that we currently do, but certainly it's something that we're open to.
Mm-hmm. Yeah, like it's sometimes it's a tough one for employers to navigate through. So, what are the goals of Mental Health Association in the near term? What would you like to see happen, being the CEO?
Yeah, well, it's exciting. We're embarking in a strategic planning process right now.
Yes.
And, I think we've identified that, again, there's a lot of opportunity for growth. And so I'm excited to partner with other communities, other population groups, people who have living in their own recovery, who want to give back, who want to connect with us. I really want us to be a community center for well-being. And so really, really designing what that looks like, and that's ever changing as well.
Sure. Oh, I love it. The well-being is so important. Yeah. What impacts have you seen in the community and what you hope to see in the future? Like, what kind of stories have people shared, in terms of their engagement with the Mental Health Association, being a patient, a client, or whatnot?
Yeah. Well, I mean, I think that especially since COVID, the topic of mental health is more on the table now. It's talked about more. I think that there's less of a stigma. I think that there's still very much a stigma. But I think the more that we talk about it, the more that we're open about it, we normalize it, it just is what it is. It's not anything to be ashamed of. We all go through life with struggles, and so to be able to share and not feel like we have to go through those struggles in isolation is really important. Our community is hurting in so many ways, and I just think that there's so many opportunities to connect with each other, and support each other. That I guess that would be my hope, and what that looks like, I think, can go in so many different ways.
Yeah, I agree with you, because often mental illness is thought of as an odds thing, but it can be like any physical ailment. It's just that we don't have the visual of the mental, because it's inside.
It's a hidden illness.
Illness,
we call it a hidden disability.
Oh, okay. All right. Well, thank you for educating me in that proper language.
Yeah. Well, it's not like, a broken arm where you can see on the outside or something like that. So you never know somebody's struggles, right? Until you sit down and you begin to get to know somebody and talk with them. We all have stories.
Sure. Yes, that's right.
And, to me, that's what's most exciting about this work is learning about each other and learning about each other's stories and the resilience, the power of resilience in all of us.
And helping each other be more resilient. I think having that support system makes it so. I kind of think of it like a building. You need the bars, you need the steel bars, you need the cement, you need all those things, or whatever construction material that is all fabric of the whole process. So it's great. That's wonderful that you. And Village Gate's a great location. Its bus line is there if people need to have transportation, easy access to transportation.
Yes.
And it's a great space too.
It is. It's a wonderful space.
Yeah, that's great. That's terrific. And so, what is the fun thing? This is going to be an off-the-cuff question. What is when you go to work each day, what makes it so attractive or fun? Like I've been doing my work for 40 years. I love it so much that every day is just so exciting. You know what I mean? 40 years sounds like a long time for many people, but I just have so much passion about it. What would you say is what kind of gets you to work feeling good about what you do?
Well, I think it's connecting with people, and knowing that the work is purposeful, and meaningful, and that it really does make a difference in people's lives. You know, what I'm excited about is the opportunities that are before us for MHA and kind of being a designer of those services, right? Like I said, there's just so many opportunities where I think we can do more and do better in the community in terms of talking about mental health and bringing mental well-being resources. So that's what I'm excited about.
Yeah,
That's what I'm excited about.
I mean, I even think about people who felt a trauma of, say, for example, someone who took their life and you're surviving relative.
Yes.
To have that kind of like, well, what can I do? I'm feeling helpless.
Yes.
But if I learn through this and help as a peer, or then that could, or at least train and understand, because the person's not there anymore to say what had happened, you know, or what made them decide to do something. So,
absolutely. That's one of the other things that we do at MHA Rochester is we serve as the facilitator for the Community Suicide Prevention Coalition. And that's something very near and dear to my heart because suicide is has such a devastating impact, you know, to family, to loved ones, to the community. And so we have a coalition of different community partners who are doing the work in terms of prevention and intervention and what we call post-vention work.
Post-vention work.
yeah. And so at the MHA, we offer different training for the community around suicide prevention. And you know that is definitely one of the areas that we don't have enough funding for, that we specifically are you know, have a target goal for raising funds around.
Yeah, well, that's great. And so you have like different events. So if someone wants to get involved, they can go. What is the website for MHA locally? What's that website?
MHARochester.org.
Oh, okay. That's MHARochester.org. Great.
Yep. And there is a link to our Suicide Prevention Coalition website on that link as well, which is suicidepreventioncoalition.org.
Oh, great. Wonderful. Sounds like all the resources are there that someone might need. Well, this has been a very delightful and educational conversation. You know, it's just kind of, like you said, bringing the health, the well-being of our citizens and just being healthy.
Yes. Thank you. Thank you for having me.
Yeah, thank you. And thank you for sharing with us that the funding is there, recognition, because often that's the frustrating part, right? But then people can also donate if they wanted to.
Absolutely.
And help your fundraisers. So
that's right.
Get
involved. That's right.
Well, thank you. Thank you so much, Valerie. It's been a delight having you here. And really, I've learned a lot, not knowing about the organization, but it feels good that there's this place that people can go to and contact and be of help. I always say that emotion needs motion. So this is kind of helping that motion for someone to do something to be of help.
I like that. Yeah,
thank you. And thank you, our viewers, for joining us in this segment of It's About Money. My guest again is Valerie Way. She's the president and CEO of Mental Health Association of Rochester. And thanks for putting up with my hat. Until next time.